Good morning, everyone. Today we'll be talking about Finding Mental Health and Well-Being for Those with PTSD by Nicole Schnars. An overview of deployment-related PTSD. What is deployment-related PTSD? It is trauma experienced during a deployment-related event where constant threat and traumatic exposure are experienced. Current modern methods of treatment involve psychotherapy, such as exposure therapy or cognitive behavioral therapy, and usually medications such as antidepressants or sleep aids. Non-traditional forms of treatment have been developed, specifically what we'll be talking about today, animal-assisted therapy, and are being implemented during the recovery process to encourage emotional and developmental growth. Some controversial treatment methods involve prolonged exposure therapy and their effects on civilian trauma versus military trauma. Some questions. What are alternative methods of treatment for combat-related PTSD? Today, specifically, we'll be talking about animal-assisted therapy. And what are success rates in treating symptoms of PTSD with alternative methods, such as AAT, meditation, or yoga? Our first expert is Dr. Tonya McFarland and her dog Maggie. She has 20 years of experience as a licensed clinical psychologist specializing in depression, self-harm behavior, and trauma. She's a professor at the University of Denver teaching ethics and a clinical supervisor for Eating Disorder Foundation in Denver. She's a certified animal-assisted therapist, and Maggie, her dog, is registered through the Delta Society Denver Pet Partners as a licensed therapy dog. She believes in using AAT to combat depression symptoms such as loneliness, negative stigma, and to decrease the dropout rate among veterans. Expert number 2 is a registered nurse named Patricia Cheeks. She has a master's degree in psychiatric health nursing and is a certified healing touch practitioner. She has 30 years of experience with counseling and specializes in life transitions, PTSD, trauma, and anxiety. She's a public speaker and life coach who believes in the healing powers of nature through the practice of meditation and yoga. She believes the symptoms of PTSD vary. Therefore, treatment of each occurring symptom should be based on individual symptom diagnosis to include complementary and alternative medicine. To compare both Dr. McFarland and Patricia Cheeks, Dr. McFarland, she has her therapy sessions in a formal therapy setting, whereas Patricia Cheeks will do her settings in naturistic environments to encourage the bond of person with nature. Dr. McFarland uses clinical administered PTSD scales, whereas Patricia Cheeks will treat the symptoms individually as they occur, and she does not use certified administered scales. Dr. McFarland uses cognitive behavioral therapy, which is an approved method of PTSD treatment, and Patricia Cheeks uses spiritual relaxation rituals to teach the person to relieve anxiety. Both of them, however, do believe in using alternative medicine during treatment to treat physiological reactions. Dr. McFarland uses AAT, which is not a certified form of therapy licensed yet, but is in the process of becoming so, and Patricia Cheeks uses a more holistic approach. Here are my references, and thank you very much for listening.